Hello?
Hey babe, where are you now?
I'm driving home.
Where did you stop before heading home?
At the gas station.
Interesting, and who did you leave there?
Why are you asking me these strange questions? Of course I didn't leave anyone there. Oh, wait, I left you at the gas station. Don't go anywhere. I'm turning the car around right now.
She forgot all about it. Let's talk about what causes for forgetfulness, like the way she did. Today, we're gonna talk about dementia. What is dementia? And how dementia affects your life. So dementia, it involves in declining in your mental ability that you need your daily life. You may forget everything about it. Because sometimes it develops when there's a damage to the part of your brain that involve learning, memory, decision making, and language. So dementia itself is not specific disease. It's just a clinical description of set of symptoms that caused by underlying brain disease. The one we talk about is Alzheimer's disease. If you have it, you might forget even your name, your loved one, your neighbors, and sometimes you can forget everything. Because the more you age, and it become normal for aging. So this type of dementia, there are three types. They are primarily. A brain disease is the main cause of dementia. There aren't any other cause. Example are those four. This is the primary one. Alzheimer's disease, that is frontotemporal dementia, vascular dementia, and mixed dementia. Those are primarily cause of dementia. So the secondary one is this is type that happen when another medical condition that cause change in your body, the brain dysfunction. So the medicine or another condition is what affect your body. So if someone on a medication cause change in your body. So those are secondary. Example are infection, alcohol related. Those are secondary dementia. So there is reversible dementia. Some secondary cause of dementia could be reversed from treatable, and it can be treated like vitamin deficiency, medication side effect, and the one we talk like infection, all that. So those are reversible. So let's talk about symptom and causes dementia. Dementia is a decline in mental ability that you need for your daily living. So cognitive function symptom like memory loss, difficulty reading or writing, trouble speaking sometimes, unsure of what you are doing, you forget what you want to do or what you plan to do, forgetting recent event, repeating question after answering, misplaced commonly used items, forgetting how to do daily tasks, like you can even forget how to drive sometimes. So symptom of dementia, because symptom can vary from one person to other. We talk about it. There's cognitive symptom like difficulty sharing thought, having trouble saying what you want to say, memory loss, forgetting names, past events or any other thing, problem following direction, not understanding or remembering steps, trouble with language, finding hard to read, write, or understand word. Behavior and psychological symptom. Those are like moods. One is agitation, feeling restless or upset, anxious all the time, feeling nausea, nervous or worried all the time, depression, losing interest or feeling sad, disorientation, not knowing where you are or what time is it, irritability, feeling frustrated or upset by tasks that might be easy. So irritability. So another one is hallucination, You see something and hearing things that doesn't exist. Also paranoia, thinking others are trying to hurt you also. Fidgeting or repeating movement, pacing or finger tapping. Sleep problem, waking up after often at night or sleeping during the day. Those are signs. Those are behavioral and psychological symptoms. So dementia, there's a stage in dementia. So a stage in dementia, there is 3 stages. There's early stage, mild, like the lady we saw, and there's middle stage, that is the dementia, that's moderate. Late stage dementia, that is severe one. In the early stage, it affects your daily life, but not severely. You may notice some memory or thinking problem, but you can still do most self-care tasks at home, like dressing, bathing, and making simple meals. In middle stage, thinking and daily tasks become harder. You may need remembering or complete something. In the last stage, you need daily help and may require full-time care. You might even forget your name. You don't know the person who talked to you, who are you, when that is the late stage. Most thinking skills are lost and you need support with basic activity like reading, bathing, and getting dressed. What really causes that dementia? It caused by damaged brain cell cause. Damaged brain cell is what causes dementia. In most cases, this damage comes from neurodegenerative diseases. That's what still we say dementia is for people 65 and above. This change affects part of the brain and control memory and learning language and decision making. So brain cells need to talk to each other by sending electrical signals. These signals are brain works. When something blocks the signal or damage the neurons, it can't work properly. So there's some people with specific gene that they develop dementia than others. So that is the first cause of dementia, which is primary. Secondary dementia, it caused by secondary conditions like alcohol related, like encephalitis, meningitis, those are infections, multiple sclerosis, Wilson disease, Jacob diseases, all that. Those are diseases or secondary dementia. Reversible dementia. With reversible dementia, symptoms will go away once you treated the cause. The common cause are bleeding in the brain, that is subdural hematoma, brain tumors, disease of other body organ like liver, cirrhosis, renal failure, fluid build-up, hydrocephalus, hormone-related disorder, Addison disease, Cushing syndrome, those hyperthyroidism diseases, thyroid diseases, infection like syphilis, HIV. So like vitamin deficiency, vitamin B1, B6, B12, copper, or vitamin E. So if you take it, you can reverse the memory. There is risk factor. Such a factor may be related to you may be risk of dementia, age. If you get old, you can't avoid age because by getting old, the bigger risk is most diagnoses happen between 65 and above. Even if some people even get, if you have those secondary conditions or reversible conditions, so age doesn't matter. But mostly primarily dementia are caused by mostly age 65. So family history. If your biological parent or sibling had dementia, so you are at risk factor. Other one is Down syndrome. So Down syndrome increase the risk of getting symptoms, especially on early age. So even small children, if you have Down syndrome, so that's another risk factor. Heart and blood vessel problem, condition like high blood pressure, high cholesterol, diabetic, smoking, all that, you will be at risk. Race and ethnicity. Black adults are susceptible to worse likely than others, like Hispanic and white people. Serious brain injury. A severe head injury and loss of consciousness during your life can rescue to dementia. So let's talk about if you get dementia, what's the complication? Because your brain control everything your body does. When it stops working properly, it can affect your health. Dementia can lead to serious problem because it's the brain that tells the body what it does. You can get bed sores, dehydration, and poor nutrition. You can get trouble managing your pee or your poops, fall injuries, and broken bones. You can get pneumonia, sepsis. So all these are life-threatening. How do you know you have dementia? So there's a diagnosis and test the doctor can do. He can ask about your symptom, how it happened, review your personal and family history, medical history, so can look for medication you are taking and order some tests. So your KT may need also to get the right diagnosis by ordering some tests. So there's the dementia testing like blood test, the CT scan, MRI, mental status exam, PET scan, neuropsychotic evaluation, and spinal tap, lumbar puncture. How will we manage or treat, or how will we do that? Is there a cure for dementia? Right now, there's no cure. So it's just management. So no treatment that completely stop dementia from getting worse, but you can provide or you can help manage symptoms to this so that it won't affect your life, your daily life. So treatment can look different from each other. Dementia affects everyone in different way. What work well for one person might not work for the other person. So these are dementia diseases like cholinesterase inhibitor, this donepezil, those that improve by changing the chemical balance in your brain. There is this NMD receptors antagonist. They control signal in your brain. It may help memory and make easy for everything. There's those other disease for Alzheimer's disease. It can also help. Also antidepressant, antipsychotic may help mood and behavior change. So those are treatment. These are non-medication related dementia. So treatment may include additional way to support improve your brain function. So managing any health condition that affect your brain like diabetes, blood pressure. So if you are diabetic, if you are someone who is hypertensive, you can manage your drugs, balance your vitamin, calcium, thyroid, and blood sugar level. Change your medication type or dose. Having surgery, remove if you have a tumor to reduce pressure in your brain. Treating infection with medication. Eating healthy food. Participating in regular physical exercise. Being socially engaged. Having hobbies to change your skills. To challenge your skills, at least so that you won't stay in one place. So make appointment with a provider if you notice this, or someone you know notice this. Ability to perform everyday task, behavior, memory, and mental function. So symptom, if you see that you have a problem remembering things, you can't do anything for yourself, or you are forgetful, and there's a change in your behavior, memory, and mental function, you should go and see your care provider. Guys, thank you for watching. See you soon. Bye.